The next Palmer point, 11.19, Xin Chang, or heart normal, I use in combination with heart gate, which is also another single point that we've demonstrated. I use these together for conditions of the heart when not using the thumb points on the midline of the thigh. For arrhythmia, tachycardia, bradycardia, all kinds of different heart conditions, but primarily those palpitations are they effective for. Again, as I said, there's another Palmer point, and differently than the wood inflammation point, which was on the D line, this is on the middle finger, on the midline, on the C line. And it's also in the most proximal segment, so halfway between the middles of the flexing of the joint, of the phalanges, on the midline. Pen's not working so well. But again, this is also measured in a similar way in that it's a third in, so it's a third, and a third, or just a third in and a third in. They should all be equidistant between the points and between the point and the fold on the phalanges. Also, these are needled into a similar depth as wood inflammation, 1120, in that they will be 0.25 to 0.66 swim deep. Now, some people may do them a little bit more shallow or a little deeper, but essentially in that neighborhood, depending on the tissue of the particular person. So again, you want to hold firmly the hand and have a place to rest some aspect of your hand or finger so that you're not needling in the air. Again, you're using a small half-inch needle, and you are going to be resting it on the point to desensitize it. I don't know if the camera can see that. And then through, and then take it on down. And its pair, also a third of the distance between each needle, a third of the distance between the phalangeal crease on the midline, the C line of the middle finger. Again, we want to stay perpendicular, not needling in the air. Rest on the surface to begin to desensitize it, and then through, and then take it on down. And do your best to make sure they look pretty. And with this particular point, I would often set up a few towels or something so the person's hand would relax in a way where they don't feel contrived in holding their hand, having to do any work during the treatment, which could last from 40 minutes to 60 minutes. So by no means do you want them to labor during this time.